Hello everyone and welcome to my strategic plan presentation. My name is Honor and I will be your host. This presentation will discuss the use of strategic management skills to implement a change that is intended to improve the functionality of the Department of Social Service here in Connecticut. I will be happy to answer any questions following this presentation. The strategic planning of any organization is a process based on the functionality of the internal and external environment of such organization. The process identifies areas of the organization that are deficit and therefore justifies the purpose of the proposed intervention and recommended solutions. First, let me highlight a key strength of the Department of Social Service. The strength of DSS of Connecticut is that it provides services to the elderly, families with children, people with disability, and other adults. Another strength is that it is funded and supported by the state of Connecticut and all its affiliates. However, there is a profound weakness pertaining to the service of DSS and its measures of security regarding clients' information. Clients' information can be accessed too easily as a direct result of public knowledge and the ease of access to what was once private information. The opportunity here is for the identified areas to meet its full potential in regards to the security of clients' personal and medical information. Threats persist through the trends of technology and increased healthcare networking. This remains a threat to society in the sense of access to information by use of common personal identifying markers such as date of birth, telephone number, and address. The impact of such threats would be greatly devastating and stands a chance of going unnoticed for an extended time. In such cases as identity theft, or Health Insurance Portability and Accountable Act breaching, individuals may not even be aware of the security breach until it has caused great damage. In such case, many victims may be unaware or unable to rectify the situation due to the complexity of healthcare system and the associated programs of the organization. Let's look at the mission statement. The mission statement of DSS reads, in part, guided by the shared belief in human potential, we aim to increase the security and the well-being of Connecticut individuals, families, and the community. The statement as a whole captured the interests of stakeholders of all departments of the Department of Social Service and all of humanity in the vicinity of Connecticut. The single-use strategic plan and that I am proposing to put into action would ensure that everyone is working towards the same goal of high standards and exceptional quality, and will require functional improvement, maintenance, and operational reliability of the entire organization and its existing stakeholders. This is a functional level operational strategy that will be executed by utilizing management by objective and management by means. It is expected to elicit competitive advantage through contingency planning, the building of scenarios, and crisis planning. Strategic goal would be met through influential support and the motivational involvement of different departments, both internal and external to the organization. This is where members of the organization comes into play. Appropriate decision-making behaviors will be based on administrative models that recognize the potential and limitation of the organization and the environment and the relationship between the two. Because both the internal and the external business function will be affected by the action plan areas of administration, operations, human resources, and information technology will be kept in collaboration through communication and divisional structure maneuvers. The actual process of the action plan to secure the medical and personal information that is communicated through DSS will take more doing by the community and the frontline employees. The access of DSS information made by individual will be through a computer system that will record each response of individual in the community, then compare the new information obtained to the saved security questions and allow access based on whether the security criteria has been met. In addition, data will be collected on how well employees of DSS handle questions regarding increased security, which will reveal signs of satisfaction and signs of dissatisfaction. The interactive process of added security and the feedback process is expected to take under 2 minutes to complete as modifications are made and the process moves forward. The method of telephone survey will be utilized to gain insights to the success of the implemented method and its effectiveness through the feedback control model. Staff will be trained to answer questions correctly and in a timely manner, and an internal measurement tool such as a survey will be given to employees. This is so that they may voice their opinion on how well the organization as a whole has adapted to the plan and the survey system. I believe the implemented plan and the evaluation process will create the best and most effective and efficient methods of collecting data and revitalizing the action plan to meet the expectation of the functions of the DSS mission statement. The entire strategic plan is believed to have minimal financial weight. The process consists of the reprogramming of our current telecommunication system by the IT department, the increase in staff to handle unforeseen crisis, and the training of staff to answer and handle questions and situations over the course of the next 3 months. In other words, the feedback provides validity of the action plan and give overall information on how the organization is doing in the efforts to secure the medical and personal information that is communicated through the Department of Social Service. To conclude, the evaluation of any implemented action is necessary to comply with the organization mission statement, its embedded standards, and provide evidence, performances, and provide full, useful knowledge towards innovations and improvements. This concludes this presentation. Again, my name is Honor, and thank you very much for joining me. Please consider this proposal as if it were designed to secure the personal and medical information of your loved ones. Thank you.